My name is Dr. Bill Lile. I practice obstetrics and gynecology. I'm board certified in obstetrics and gynecology, and I'm licensed to practice medicine in both Florida and Alabama. I grew up in New Jersey, a little different than here in the South. I had a mom and dad, married, good Christian couple, went to church on a regular basis, had a younger sister. We grew up understanding the meaning of life. It wasn't until later in life that my mom told me the story about her challenges with her pregnancy when she was pregnant with me. Her first pregnancy ended in a miscarriage, and she was having lots of complications, and her doctor actually had encouraged her to have a pregnancy termination because she was so sick. And she said, no, I understand it. Even though there was no ultrasound and technology back then, she realized the value of life, and I didn't find that out until I was in my 50s. But we grew up even in high school and college understanding that abortion was wrong, and we were involved in the pregnancy centers and the outreaches up in New Jersey, and it was a vital part of our lives and the churches that we attended. I had a skateboard accident when I was younger. I was riding a skateboard down a twisty, windy driveway that was lined with stones set in concrete. And we didn't wear helmets, we didn't wear elbow pads, knee pads back then. And I had a pretty bad wipeout, and my head went right into the stone wall. And so we went to the hospital, and the ER doc says, I'm not putting that together. So they called in a plastic surgeon named Dr. Kraus up in Cherry Hill, New Jersey. Dr. Kraus was real cool. He knew I had an interest in medicine. I was probably only 10 or 12 years of age back then. So Dr. Kraus came in, he took a look, and he told me what he would do and how if he was an ER doc, he would just put it back together. But he described how he was going to cut it on one side, trim it, and make it all match up. And then he even asked if I wanted to watch. And he had the nurse bring in a mirror. He set up the mirror so that I got to watch him do the plastic surgery on my head, do the plastic surgery on my knee. He told me what medical school was like, the length of time that for the commitment. And I wasn't even in high school then. And I said, boy, I think I want to do that. Didn't think it was going to be plastic surgery, but I knew I really wanted to be involved in medicine. As far as the specialty, I really didn't know I wanted to do obstetrics and gynecology until medical school. I really went into medical school thinking that maybe I wanted to do ER medicine, general surgery, had maybe thought about obstetrics and gynecology, but it wasn't until I was in medical school and had done an OB rotation. There were a couple of things. One, you're delivering babies, one of the coolest experiences you can have. Also, when a woman is pregnant and going into the hospital, that is the only time when somebody is going into the hospital and they're happy about it. They're excited to go into the hospital, and nobody's excited about their gallbladder, their knee surgery, their shoulder surgery. But you're excited when you're having a baby. Plus, you were dealing with young, healthy moms. And when you're dealing with young, healthy moms, it's just a natural process. The other thing is that you got to know your patients through so many different phases of their lives. You got to know them as an adolescent. You got to know them through high school and college. You got to know them during their fertile years, and you got to deal with them through menopause and when they would have surgical needs. So when you find yourself on an orthopedic rotation, but you're still doing all of your reading in obstetrics and gynecology, that's probably the best way to let you know that's probably what you need to do. And I've been in private practice now for 20 years, loved every year. I think my motivation is that I just love what I'm doing. I love coming into the hospital at 2 o'clock in the morning. Tuesday night, I delivered 7 babies. It was all night long. We had multiple moms in labor at the same time. And it was just a beautiful process. So I still enjoy it. It still puts a smile on my face. There's nothing that is more special than delivering a couple's baby. That moment, every time, I've delivered almost 4,000 babies now. It's special every single time. It's enjoyable. It's a time to celebrate. The surgery is also fun. I couldn't imagine going to medical school, residency, and not actually spending time in the operating room. I just came out of the operating room. I love the operating room. To me, it's the ultimate team sport where you work together, you have anesthesia, you have your surgical tech, and you all have to work together to make this symphony really flow and to have it be safe. There's time to have fun, but there's also always that time where you've got to really focus. But it's amazing to change somebody's life through a surgical intervention where they go into the operating room with a problem and then they leave the operating room and you've cured them of that problem. So I enjoy doing it. It's been 20 years and I don't see any reason to stop. I think one of the most amazing cases I was involved with was the first time we did a abortion reversal. We got a call from a young lady who lived over in Mobile, Alabama. She and her boyfriend found out they were pregnant. They were actually engaged at that time. And they went to Planned Parenthood, not because they went with the intention of aborting the baby, but that's where she knew the address, she knew the phone number. That's where she went for her GYN care. So they didn't go there with the intent of having an abortion. They went there with the intent of finding out more information. After they spent about an hour with her or so, she signed the consent, she swiped her credit card, and she was given the chemical abortion protocol. She was given an abortion that would then complete itself when she went home. She and her fiance sat in the parking lot after they came out of Planned Parenthood, and they didn't say a word. They just sat there like, what just happened? We came here with one mindset. Now what's going on? Well, she was in nursing school at the time. So they went home, didn't say a word, but she just kept thinking about, what did I just do? But she knew from her nursing training that when somebody makes a bad decision, they've taken a narcotic and they show up in the emergency room. The emergency room physician has an obligation and a duty to treat them even though they made a bad decision. They'll give them a medication called Narcan. Narcan is an amazing reversal agent for narcotics. It's like a switch. Somebody can be unconscious, not breathing, have no awareness of what's going on. You give them an injection of Narcan, it's like you just turn the switch. They will wake up within seconds and they are a totally new person. So she thought to herself, is there an antidote for what I was given? So she did some research the next day and she found a website called Abortion Pill Reversal. She contacted the nurse for abortion pill reversal, and the nurse that was on call happened to be in California. It's now Sunday morning. The nurse gets the information, she finds out where she lives, and she looks for a physician that's in her geographic area. She calls me and says, I have this story, this young lady. And she says, can you help her? I said, well, I'm in church, I'm getting ready to go out and sing, but give me the information, I'm going to give her a call right now. So I didn't go out and sing, and we're getting ready for church, and my pastor's like, Bill, you ready? I said, I'm on the phone. And he's like, so, what's going on? I said, I'm trying to reverse an abortion. He's like, go, go, go. So I was on the phone with her, she tells me the story, and I said, look, these are the protocols. This is what we can try and do. I said, would you like us to do this? She said, absolutely. She goes, I made a bad decision. I know it was the wrong decision for me. She said, let's do what we can. So I got her information, and now I'm calling pharmacies over in Mobile, Alabama to see if they stock the medication that we need to reverse this abortion. So we found a pharmacist, and I tell her what we need, and the pharmacist paused, and she said, Dr. Lyle, she goes, are you trying to reverse an abortion? And I paused and I said, yes, ma'am, I am. She goes, I'm going to take care of this girl personally. So I give her the information and she takes care of it. So I called the patient a little bit later on that afternoon. And I said, hey, it's Dr. Lyle. Were you able to get to the pharmacy? And she says, yeah, I was. She goes, that is a strange pharmacy. I said, what are you talking about? And she goes, well, I get there, I tell the pharmacist my name in that little counseling area, and she said the pharmacist came around the counter, she gave me a big old hug, and she said she'd be praying for me. And then when she gave me the medication, she goes, I was going to pay for the medication. The pharmacist says, oh no, sweetie, I've got this myself. So the pharmacist, out of her own wallet, paid for this girl's reversal medication. So we saw her in our office right here about a week later, and we did an ultrasound. We had heart tones. A week after that, we did an ultrasound. We still had heart tones. We had successfully, that was the first time I'd ever successfully reversed what had been initiated as a chemical abortion. 98% chance of success in taking the life of that baby, and we had reversed it. But then the most exciting part was when we delivered that baby. You know, you knew that that baby was on a path, for death. That was the destiny of this baby. And it was about 2 o'clock in the morning, we delivered that baby. And I still carry a picture of myself with that baby. And that'll always be probably one of the most special deliveries for me, just because of the story behind it. The other story would be the first set of quadruplets that I delivered. There's something amazing. I mean, 1 is cool, 2 is really cool, 4 is off the hook. So caring for a mom who was carrying 4 different people there on the inside and having a great outcome, those are probably the 2 cases that I'll remember for the rest of my life. The motto that I was taught in medicine was Latin, prima non nocere, which is, first of all, do no harm. And it's kind of what you're taught. I mean, I was in medical school 30 years ago. It's what you were taught as far as that is our first edict. We do not want to do harm. We want to heal, but we do not do harm. And when we're thinking about whether it's surgery, chemotherapy, medicine, there's always risks, benefits, indications, and alternatives of different procedures. So our duty as a physician is to educate the patient as far as those risks and benefits. But in the bottom line, do no harm. Heal the patient, but do no harm in the process. We've always treated the mom and the baby as 2 patients. But our technology is changing how we treat these 2 patients that we're caring for. Ultrasound, when I was in medical school, was really very much in its infancy. We could see ultrasound, we could see the baby, but not in the details that we can see now. We would diagnose the baby with abnormalities, but now we don't just diagnose spina bifida. We just don't diagnose heart abnormalities. We don't just diagnose medical issues. We can now go into the environment of the baby, into the womb, and we can do surgery on the baby. It used to be even for an adult. If an adult needed to have their gallbladder taken out, it was a huge incision that would be along this side underneath of their ribs. They'd be here for days, if not weeks. Now it's an outpatient procedure. You get a laparoscopic surgery, you get 3 Band-Aids, and you go home later that afternoon, same surgery was done. Well, now we're taking that technology and we're operating on the babies on the inside. At centers around the country, they're actually doing heart surgery on the baby as early as 22 weeks gestation. I mean, a baby's heart is about the size of a grape at that gestational age. At centers up in Philadelphia and in Houston, Texas, they're actually taking little trocars. They go through the skin of the mom. They go through the wall of the uterus. They actually go into the fluid around the baby, and they'll go right up to the chest wall of the baby. And for different conditions, one of which is a valvular problem called aortic stenosis, where the valve coming out of the ventricle is just so tight that the blood can't go through. It needs to be opened up. The baby is just straining with every heart contraction to get the blood to go through. They can actually take a catheter, they can go through the wall of the chest of the baby, go right up to the heart, guide this catheter up into the heart of the baby, and then with imaging, they can inflate that tiny little balloon at the end, and they can open up the valve of the baby's heart. Within 60 seconds, you see improvement of the blood flow in the baby's heart the size of a grape, in a baby that is just on the beginning of when it can even maybe survive on the outside. They're already doing heart surgery on these babies. So the interventions, and not only what we're doing now, but the interventions that'll be available a year from now, 5 years from now. Children's Hospital in Philadelphia is now doing about 200 fetal procedures on the babies every year. That's 4 a week that they're doing at Children's Hospital of Philadelphia. We just did our first fetal surgeries here in the state of Florida in Orlando just a few months ago. So it's a whole new area of medicine that is just going to be growing, not just because it's cool, but we are saving the lives of babies with interventions that if something wasn't done, these babies would die in the womb. Even here at our hospital, we can do blood transfusions directly to the baby inside the womb as early as 19 weeks gestation. The baby's a totally different person from the mom. You'll hear sometimes pro-abortion people say, "It's my body, I will do with it what I want to." Your body is an amazing life support system for the baby that's on the inside, but from the moment of conception, that's a new person. That baby is genetically unique from the mom, genetically unique from the dad, genetically unique from the other 7 billion people on the planet. And there are conditions where the mom has antibodies which will attack the baby's blood type. And these antibodies can cross the placenta, come into the baby's circulation, and start to attack the baby's blood cells. The baby's blood count will drop. Well, just like an adult, if an adult has a bad laceration and they come to the emergency room and their blood count is dropping, well, what do? We give them a blood transfusion. We can give blood transfusions directly to the baby in the womb as early as 19 weeks gestation, where somebody will go down to our local blood donation center and they'll donate their O negative blood. We might use that O negative blood that somebody donated at our blood center or the blood bus that comes to their office, and we can actually guide a needle through the belly, through the wall of the uterus, through the fluid around the baby, go right up to the umbilical cord, right into the vein, put a needle into the vein, and we can give the baby a blood transfusion. Saves the baby's life. Sometimes we have to do that every 3-4 weeks throughout the entire pregnancy because the mom's antibodies are still attacking the baby's blood. Once the baby is born, you follow the baby, but they no longer need blood transfusions because their blood is not being attacked by the mom's antibodies. So fetal medicine, maternal fetal medicine, is just a growing and advancing field, and I just can't wait to see where it's going to be in 5 years. Mom is the life support system for the baby. If mom isn't healthy, then baby's not going to be healthy. And, whether it is taking care of the mom's diabetes, taking care of the mom's high blood pressure, taking care of the mom's nutritional needs, emotional needs, psychological needs. Maybe she's smoking. Well, smoking is one of the worst things you can do for your pregnancy. Well, let's help her. Let's help her get off of this smoking. Say she has a dependence problem with narcotics. Well, we need to help her. We need to help her. If we can help counsel her and get her off the narcotics, then the baby won't be withdrawing from narcotics after the baby's born. So maybe we need to get mom in a different environment. What are the social needs that the mom has? Is she in a bad environment and needs to be in a better environment? Does mom have financial needs? We have so many resources, not only hospital resources and government resources, we have private resources. We have pregnancy centers that are here to help the mom, help her with her needs, not only during the pregnancy, but even after she has the baby. Maybe mom is not able to take care of the baby. She goes, this is just not the time for me. Well, adoption is a fantastic option. We have multiple adoption agencies that will help match the patient and her baby with a couple that, for whatever reason, can't have a baby. We have thousands and thousands of couples that would love to have a baby. We just need to match them up with somebody who's been blessed with a baby, but this just isn't the right time for them to have a baby. You have to ask them, well, if the baby is not valuable inside of the womb, is the baby valuable on the outside of the womb? A baby is the same person whether it's on the inside or the outside. Here in Florida, you can perform an abortion up till 24 weeks gestation. There's an amazing thing called delayed interval delivery. It's like, well, what's that? And a typical example would be a mom is pregnant with twins. She presents to the hospital, and before we can do anything, she delivers that first baby. And that baby is cared for and taken to our intensive care nursery. Doctors care for the baby, nurses care for the baby, technology, ventilators, all sorts of equipment. But if the bag of water on the second twin is still intact, we'll counsel the mom, and our maternal fetal medicines doctors will counsel the mom and say, we have 2 intensive care nurseries. We have the one down the hall with all the doctors, nurses, and technology, and then we have the one designed by God, and that one's here in your belly. And right now, this intensive care nursery is meeting the needs of your baby better than all the technology. Your bag of water is intact. Your baby, with our monitoring, is doing well. We'd like to keep this baby in your womb as long as we can. As long as this is a better environment than that down the hall, we'll keep the baby here on the inside. We don't just get hours, we don't just get days. There was a case up in Tennessee, 6 weeks. You had identical twins conceived at the same moment in time, 1 egg, 1 sperm. One baby is down the hall in the NICU and the second baby is still in the womb. You can have one identical twin born in June and the other identical twin born in August. But here's the amazing thing. The baby that's in the NICU has all the rights and protection that I would have if I was in a cardiac care unit. Yet if the mom were to choose, she could go to a center and she could take the life of that baby. Say she said, you know, I know I had twins, but I really only wanted one baby. She could actually legally find somebody who would take the life of that second baby, even though they're identical twins, one egg, one sperm. So our geographic location doesn't either give us our rights or take away our rights. A patient needs to be treated with respect. This is something we learn, in medical school. It's something that we teach in residency, that we treat all of our patients with respect. They are persons. Well, patient is a person. Well, if a patient is in the womb, it's still a person. So we need to respect the patient in the womb. A patient is a person, no matter how small. Respect them, treat them with love, treat them with concern, meet their needs, heal them, and do the best that you can, whether they're in the womb or outside of the womb. Science proves, even from the moment of conception, you have one cell from the mom and you have one cell from the dad. And when they come together, that first cell is unique from any other cell on the whole planet. It's unique from mom, it's unique from dad. That is the new person. We can even do blood test on the mom as early as 9 weeks gestation, where we can find little fragments of the baby's DNA, and I can screen for dozens of different issues on the baby. I can even tell you if that is a boy or a girl in the womb from a mom's blood test. I can tell you at 9 weeks gestation, when I can't tell you that on the best ultrasound until maybe 14 or 15 weeks gestation. A lot of people now are doing tests on themselves. They're doing 23andMe, they're doing Ancestry.com. It's fascinating technology where you pay $100 for a kit, it gets sent to your house, and you collect a little bit of saliva for a couple of minutes and you send it off to Ancestry.com. They study the DNA in that little sample of saliva. They can tell you who your great-great-great-great-grandparents were. They can look back hundreds of years, many generations, and they can tell you what your family history is. When you send off that sample of your DNA, the DNA that you sent off is the exact same as the DNA that was formed from that first cell. When that one cell was formed in your mother's womb, one cell from your mom, one cell from your dad, that was you. That's when your story started. Your story of your ancestry didn't start the moment you were delivered. There's nothing magic. When I deliver a baby, all of a sudden your story and your family history doesn't start right then. That story started at that moment of conception. Genetically, scientifically, that's when your story started. There was no story when it was just one egg and one sperm. The story started when they came together. We are proving when life begins. Life begins at that moment of conception. When you have a person, whether it's in the womb or outside the womb, it's like, well, when did that really start? We can go to the delivery of a baby. Well, what about the day before? Was that a person? Well, yeah. Does it all of a sudden develop personhood when the baby is delivered? No. You go back to 20 weeks when we did that ultrasound. Was there anything magic about the ultrasound that gave personhood to that baby? No. Well, how about if we go back to 12 weeks when we could hear the heart beating with a little Doppler on the outside? Is that the moment of life? No. So you keep going back until there's a definitive moment as far as when did this life, when did this person begin? And without a doubt, it begins at that moment of conception. When it comes to, are there reasons medically where a pregnancy could be threatening the life of a mom? Yeah, there are. Do we sometimes have to deliver a baby early? Sure. There are conditions like HELP syndrome, which is a variation of something called preeclampsia, where a mom will have real high blood pressures. It's affecting her whole body. It's affecting her liver. It's affecting her kidneys. She might be going into renal failure. And if we don't, the only cure is to deliver the baby. But delivering the baby doesn't mean killing the baby. I can deliver a baby with an emergency C-section. I can have the baby out in less than 60 seconds. And that baby can go to the intensive care nursery. So when somebody says, this mom is really sick, this pregnancy is affecting her life, we need to take the life of the baby. I can deliver that baby and have that baby cared for by the NICU doctors in less than a minute. So if we need to deliver, then let's deliver and let's give the baby the best opportunity in intensive care nursery. Our average life expectancy is maybe 85. I'm 55 now, so I have only 30 years left. So my goal is to invest in kingdom service as much as I do now. To much whom is given, much is required. I'm a physician. I've been trained in the area of obstetrics and gynecology. I'm board certified, and this is my area of expertise. We've had over 62 million babies' lives taken here in the United States from abortion. God loves every one of these babies. God is a loving God. God is a forgiving God. But if you look back in the Bible, you can see, and the children of Israel did evil in the sight of the Lord. And he would deliver them into the hand of their enemies. He would deliver them into the hand of Midian. I love this country. How long is God going to be patient with the United States when we're taking the lives of 1 million babies every year? So I want to share the gospel, but I also want to protect the future of this nation. This nation really is that shining light on the hill. If this nation falls, the world will just fall right behind it. This is what is keeping the world sane. So we must maintain the United States the way it was founded, with Judeo-Christian principles, with an ethic which is based on biblical principles. So those are my goals. So I only have 20, 30 years left on this planet, and this is my time to invest in kingdom service. In return, we'll all spend eternity with Christ. So teach the truth, enable them to understand forgiveness, allow that healing to begin once they've truly been forgiven, but then share the good news of the gospel of Jesus Christ. A bully is somebody who is either in a position of power, a position of authority, or is physically stronger than somebody else who will exert what they want on that person below them. Victim is somebody who has essentially been victimized by a bully. Somebody has had an opportunity to either be stronger, to have a higher authority, or just be able to put their will over top of them, to be able to say, this is what I want. I don't care what you want or what your needs are. I'm going to do to you what I want to do to you, regardless of what you want. I think I've been pressured by people who do not like what I'm doing. But, like Jesus said, they hated me. And if you do what my will is and you follow my commandments, they're going to hate you too. So that doesn't bother me at all. Use their influence, use their ability, use their knowledge, use their resources to defend somebody who can't defend themselves. And I think that's a real key, that yes, we have the opportunities to be a defender of somebody, but are we going to take the initiative to say, no, I'm going to stand in the gap. I'm going to put my life, my reputation, my livelihood on the line to protect somebody who can't protect themselves. Yeah, we have those that, we respect here on this planet and in our lives. But my primary and eternal duty is to serve my Lord and Savior, Jesus Christ. And my goal someday is to go before my Savior. We realize, my gosh, I am in heaven. I'm going to be here for all eternity, forever and ever and ever. And I think that all of our goals, when we look at kingdom service and our service here on this planet, I think all of our goals should be, we just want to hear those few words. To when we're on our knees saying, thank you, thank you, thank you, thank you. To have Jesus look at us and say, well done, thou good and faithful servant. That's my goal. One of the examples that I will use when I do a talk is I will hold up a tape measure. When I hold up that tape measure, there are 85 inches on that tape measure. And I'll cut off at 55 inches. I only have 30 inches left in my life in order to perform kingdom service, when I will be face to face with Jesus, and I'm going to see what have I done for his kingdom while I am here on earth. And the opportunity is now. Our goal is to perform kingdom service so we can hear, well done, thou good and faithful servant. So I challenge everybody to find out, how can I be involved in kingdom service? Sharing the gospel. Pregnancy centers say you're a painter. They always need something painted. They need somebody with computer skills. They need somebody to answer the phone. How can I, out of my resources, my financial resources, support them? Can I pay for their internet access for a month? Can I provide their air conditioning for a month? What can I do to contribute to this ministry? Because this is a team effort, and we all have to contribute in order to support the kingdom of Christ.